In these segments, we'll be doing counterstrain treatment to anterior thoracic tender points related to thoracic dysfunctions. The first two, the AT1 and AT2, that respectively are located midline at the episternal notch of the patient and a couple fingers breadth below where the manubrium meets the body of the sternum. And since these points are midline, we're typically going to just do a pure flexion without too much side bending, rotation, etc. But we have to cause a vectoring or a folding about these 2 points. So what we're going to do is we first locate the area after having diagnosed the dysfunction to see if there's a tender point associated with it. So here we are at the episternal notch, midline. And if we had tenderness here, we would tell the patient that this tender point is now a 10 as far as we're concerned. And now as we position the patient, we're going to try to see if we can eliminate that tender point. Now, in counterstrain, there's a few techniques where trying to monitor the tender point as you position the patient or getting them into the position and continue to monitor it is difficult, and this is one of them. So we're going to try to do this in such a way where we don't totally lose the tender point. So we're going to ask the patient to slowly help by sitting up, and we're going to get our leg under the patient. Now we're going to bring the patient back down and use my anterior chest wall or abdominal wall to hold the head. I'm going to ask the patient to put their hands behind their neck. And now that I have this tender point, I can reach around and then replace this finger so I don't lose it. And now I still have that tender point with the other finger. And now I'm just going to let the patient just fold forward with the head and neck. And you have to, again, before you position anybody into any of these counterstrain positions, you have to have already done an examination to make sure they can attain that position, because sometimes your patients cannot attain the positions for the technique. So now, since it's more purely flexion, we're just going to let the patient just sort of sink down and feel this fold right under my fingers. And once I get to that point with a little push forward and down, I give another push with my finger that's on that tender point right in there and ask the patient if it's decreased from a 10, 9, 8, hopefully down to a 0. Every once in a while you can do a little slight switch, little side bend maybe, but it's mostly just flexion and trying to sink into that spot and then hold it for 90 seconds. And again, after 90 seconds, for most of these techniques, we say return the patient to the original position in which you found the tender point through the path of least resistance. In this case, it's just having the patient just come slowly back, like so, and letting the patient fall down. Let yourself go, I'll hold you. And then go back and check this tender point and see if it's less than the original 10 that we assigned it. So this anterior T1, your finger would have just been at the episternal notch. Same technique for the anterior T2. It's maybe 2 fingers breadth below it, just as that manubrium meets the body of the sternum.